He's so much fun. And his family. His dad sponsored the tournament that was last week. Yeah, he's a cardio. Okay. Good afternoon. It's Wednesday, November 15th, 2023. I'm Sandra Larson. I'm the chairperson of the Dubuque County Health, Board of Health. It's now 4:30 and I'll call our regular meeting to order. We'll begin with roll call. Mike Fidgen.
Yes, I'm here online.
Thank you. Hi, Mike. Jess
Hello.
Smith. Jess Smith. Pat Lemkuhl did give us notice that she is out of town. Amy Crow Sunleaf.
Here.
Sandra Larson here. Dr. P.D. Joseph.
Here, present.
Hi. And Adam Hoffman gave notice that he would not be here. He's traveling out of the country also. We have established a quorum. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand if you're on Zoom or in the room. When you're called upon, state your name and home address. Individual remarks are limited to 3 minutes. Would anyone like to talk about something that's on the agenda? Hearing none, we'll move on to chairperson announcements and updates. And I have just a couple of things. Number one, Iowa experienced the 4th largest rise in mental health issues last year. Suicide is now the 2nd leading cause of death among adults ages 15 to 39. Not coincidentally, 89 of 99 Iowa counties reported a shortage of mental health care professionals, according to the U.S. Department of Health and Human Services. That's an issue that we are going to be addressing, I think, in the future. Then I just want to give a shout out to the federal government executive branch. The White House has started an initiative on women's health research because nobody's been researching women's health. And so now there's going to be some work done on that. And I think it's well overdue probably. But a shout out to the Biden administration for that. And then the Dubuque County seasonal vaccines was posted on the health department Facebook page and possibly other places, I'm not sure.
It's on our website as well.
But it's pretty informative because it tells where you can get the seasonal vaccines, who's eligible, phone numbers and everything. So it's a very nice summary, and I appreciate that. Last but not least, Monday, November 20th, 2023 is Public Health Thank You Day. So I'm sending a massive thank you to everyone who works to protect and advance public health. Your efforts save lives. Happy Public Health Thank You Day. 20th. Thank you. All right, that's enough of that.
Thank you, let's move on.
Yeah. Move on. Okay, so that's the end of my announcements and updates. I hope you enjoyed them. Next, we have the Board of Supervisors, Board of Health Liaison comments, and we have none other than Supervisor Ann McDonald with us today. So,
room.
yeah.
So that's very good. I guess that'll be the nature of this meeting. Right?
Yes.
So I also will follow up with gratitude, and today we're going to have a presentation of the community health needs assessment. And when you think back, and I guess I'm talking primarily to our board members, where we were even a year ago and 2 years ago, you get 3 years ago, you get to some darkness when we were fighting the pandemic full on, and staff turnover and retirements and rebuilding and all those things. So just gratitude to our board with your high credentials and your all the other things you could be doing as citizens. You give us your time. So thank you. And then of course to our staff, the newest staff, the new but not newest staff, and to you know, our director herself, who has have you fully passed a year yet?
Not yet.
No. So
We're getting there.
a smart person once said to me that when I was elected, all the things I wanted to do and achieve and get busy about, that was a career's worth of work for her. And so to balance that, what we all want to do and the work that you're on, I do think they merge and they meld. But you are the future. And I welcome you to this, the work that we do. So we're going to look at the China hip, and we're going to see where we are and where we might be better and where we're going to grow. But it's a career's worth of work that you're on, and the citizens appreciate that you're here. I certainly do. So I didn't mean to give a speech, but it's gratitude. So thank you
very much. Thank you, Ann. Next, we have the approval of the agenda for tonight, and I would like to make one change, and that is under action items, we have a variance request, and I'd like to move that up and deal with that first. So I make a motion to do that. Is there any discussion? Is there a second?
Second.
Any discussion? Hearing none, we'll move that up so that we can hear that first before we hear anything else. And then with that change, is there a motion to approve the agenda?
So moved.
And a second?
Second.
And so any discussion there? Hearing none, then the agenda is approved, and we'll start with the variance request for 18405 Twin Springs Drive. Who's presenting on that?
So I think we have members here. Homeowner,
I'm the son, man.
I'm sorry.
I'm the son
Okay,
and contractor.
okay. Part of the meeting packet included documentation on this, along with our environmental specialist Bailey Evanerius's recommendation. I will go ahead and share my screen that includes the packet so that we can all look at the same thing at the same time.
Would be good to date her document. I didn't see a date on Bailey's letter. But in the minutes, maybe you want to make sure that it's got you dated.
Okay. I think I'm going the wrong way here.
There's 103 pages, so.
Yeah, there are a lot of pages. And so, if I understand correctly, this property is looking to place a new well.
Correct.
And so our department performed a site visit and there were two locations that were discussed to possibly place a new well.
Yes and no, kind of.
Okay.
There's two locations, both would need a variance to put the well in. We don't need separation from the septic leach field. So one of the locations is gonna take a lot, the property really comes down at a slope. It drops real down and climbs up, so kind of down by the house right there is, it's about, and where that first blue mark is, that's level right there. Everything else starts climbing quite a bit.
Right
at
here
a
is
pretty
level?
good incline. Yes, that's our proposed where we want to drill the well. We first initially met there, we tried to get on the other blue dot there, but after really looking at it, and, we'd have to do a lot of dirt work and a lot of cutting on the hill. A lot of stuff to try to get a drill rig in there. The drill rigs are very top heavy, so we always concerned them tipping over. So, I mean, we're only moving probably 25 feet closer to the septic. But it would take a lot less to try to get that well in right there versus up on top. But still, both locations would need a variance, so.
Okay.
Could you tell me, number one, well spot, or your first choice, what is the variance that's being requested?
It's a variance, to be within, we're closer than 100 feet from the leach field. We have to be 100 feet from the leach field with the septic.
Excuse me, do you know where the leach field is?
Yeah, it's, I give it,
I have more pictures if you'd like.
yeah, it's pretty much about where that, see the septic tank right there?
No,
Is that what the star
Right
is?
there.
Square.
Here's the septic
Oh,
tank.
that
Big
Big tank.
square. Oh, there it is, yeah.
And then the leach field kind of goes at an angle towards that way,
towards the well.
towards where the well would be, yes.
Mhm.
The existing well's on the other side of the driveway. Over here in the white, that's where the existing well is, and it's
Okay.
down in a pit.
So the state law is that it has to be 100 feet from the, leach field, correct?
Correct.
And you wanna put it how close to the leach
About
field?
probably 40 feet,
You wanna
35,
put it,
40 feet,
you wanna put it 40 feet from the leach field?
correct.
So from here, where my mouse is,
Yep,
to here. What is
Um,
that distance?
that's about 45, almost 50 feet, so.
Okay.
And then the number two, choice, what's the variance that you would be requesting there?
We would still be 100 feet, or less than 100 feet from that leach bed. But I
Right.
really don't think we can get a rig up that, I mean, just after really looking at it.
What would the variance be that you would be requesting under number two?
Oh, it would probably be, we didn't really know that day we were out there measuring. Bailey went back out after she found the leach bed. She sent that to
I
us.
thought that the leach bed, nobody could locate it.
Well, that's where we think it is. I mean, there's pictures of when it was real dry out that you can kind of tell where it kind of sits because the grass gets green, you can see the lines, but.
Sure.
And what is the variance you'd be requesting under the second request, for second choice?
Would be being too close to the leach bed. Same thing.
What's the distance? That
We'll
you'd
say
be
60 feet. We're probably 60 feet from it.
So you'd be asking for a 40-foot variance there too?
We only need one spot. There's two spots that we kind of proposed. And the first spot is, you can kind of see right there, it's really level right through there to get a rig in. The second location is gonna be real hard to get all the equipment up above that retaining wall.
So it's somewhere up in
Yeah,
this
it's
area.
kinda-
But for both spots, you're asking for a 40-foot,
A 40 or a 60-foot variance. Yeah, we're asking for a variance to be closer to the leach bed than 100 feet.
a 60-foot variance, actually. You want to be 40 feet from the leach field.
Correct. That's what we're asking for.
in both spots.
No, the second spot there would be about right here, and that would be about 60 feet from the leach field. Where this one's about 40.
So, number one choice, you want a 60-foot variance.
That's the number two choice.
A 40-foot variance would be our number one. We'd want to be closer to the leach bed due to site conditions. The second spot is a little bit further up the hill. It's gonna take it'd probably take a dozer to come in and level stuff out.
I'm gonna scroll in the event that there's additional photos that might help our conversation. So this is 57 feet from the septic tank, and I'm not sure, this must be option number 2 that you're
Must be.
requesting, so 57,
Must be, yeah, that would be about option number 2.
okay.
I think that,
Don't
I think that's option number 1, and that's from the septic tank, not the leach,
The 57.
the 57 feet.
Okay. Thank you for explaining that. So this visual shows the two options. Option 1 would be approximately 40 feet, where we'd like to be 100, and then option 2 would be 60 feet. Which is, so both are less than the 100 is what we've determined.
What's the reason that you can't, find a spot for this well and within the framework of the state law? I mean,
Because the property goes like this at an incline. As you start going back towards the back of the house, the property really climbs. And then we have to try to keep it within the parcel of the property. With that septic out front, we can only, there's just that other side of the driveway is the only place we can get equipment in to drill this.
and what's the purpose for the new well?
The old well's down in a pit, has bacteria, it's cracking the casing, it's leaking surface water in.
Anybody wanna make a motion about this?
I always like to rely on Adam, and Adam's not here.
The other thing that we're gonna do with the construction of this well is we will construct this well like a public water supply, meaning that we're going to cut 1.5 inch, 3-inch larger hole than what our casing goes down. I have actually a diagram here. I don't know if anybody can see that from where everybody's sitting. But that hole, we'll cut a 10-inch hole and put a 6-inch casing, and we go along the side and we seal it from the bottom all the way back up to the surface. So that doesn't allow any surface water to run along the side of the casing and come down. So it is constructed like a public water supply. The state says we only have to grout the upper 40 feet of the casing, but we grout the entire length. And that casing is gonna go down to 100 to 120 feet and be sealed all the way back up to the surface. So to prevent any kind of contamination. The other well will be plugged to prevent any kind of contamination going in there. So,
That wasn't part of our meeting packet. Was that presented to anyone at the health department?
I mean, no, that's how we drill all our wells.
That's your standard practice. That's the standard practice of Shawer.
That's our standard practice, to construct every well like a public water supply.
Is there anybody wanna make a motion? Hearing none, we'll go on then.
Can I ask another question?
Sure.
Is the current well and septic field, would it comply? I understand you need to change it, but does it currently comply, or were you granted a variance previously? Do you know? Are they 100 feet away? from
No,
each other now?
they're not. So no, it was put in. I mean, if the well's in a pit, usually that dates it back to the 40s and 50s, and a lot of these rules weren't even around.
So it's gonna be an improvement for the landowner, it's gonna be an improvement over what we've currently got in the town.
Bailey's recommendation. Bailey's recommendation is in the packet. And she does recommend that the variance be granted. We did, so Bailey had reached out earlier in the month to, the DNR as well for their input. And we received word, from the DNR just yesterday that they do not feel that option number one is something that they would support. And option number two, potentially. That was the information that we got, that considering a variance request for the second option would be reasonable, but that placing it within less than 40% of the setbacks that are in Iowa code was
Do you have
not.
that in writing?
Who's that from?
Eric,
But I think the one thing Eric Day doesn't realize is he can't see that from standing out, behind a desk is one thing, but being on the site.
Is
You
that
would
something
see
you
that,
would
but-
want to talk to him about, Eric?
Well, I mean, the DNR now approved that all variances happen at the county level. So, I mean, we could, yeah, absolutely. I mean, I think he would, would probably agree, being that trying to get a rig up there is gonna be potentially dangerous too, so.
What did the DNR have as kind of provisions? You said they had some provisions or recommendations for the higher well, number 2 well. Was it in their letter?
I think, feel free to read it. I think it just says that it would be an option that would be reasonable to consider.
Giving a copy to the applicant, no?
I've called for a motion. Is there a motion concerning this?
I move that we table this until we hear from the DNR and the well company and DNR personnel talk, because we don't have our environmental specialist here, nor do we have our board member who's the environmental, and so I just don't feel comfortable making a recommendation or granting variance at this time.
Thank you. Is there a second to that motion? It's a motion to table.
How long is this gonna be
I'm
tabled?
sorry. Is there a second to the motion?
Second.
Okay, now any discussion? I'll start with the Iowa code provides that we can grant variances if we have enough information to substantiate the need for the action and the reasonableness of the action. And just in my opinion, we don't have enough information today.
What other information will we need to have that?
I believe that one board member said that we'd like to have the opinion of the DNR. We'd like to have the opinion of our environmental specialist to be here to present to us.
Who is that?
Bailey Avenarius,
Right, Bailey asked us to be at this meeting, so why wouldn't Bailey be at this meeting?
I'm not sure.
I have an email that says we need to be at this meeting, so.
And so then we need also some site information. Number one, we need to know where the field is. And nobody knows. So someone has to determine where that is so that we know what we're given a variance for. And then as far as the option number 2, that's a little bit better, but I think we'd have to look at that more closely, really. So that's my thought. Any other discussion?
So how long will this be tabled for?
Until we get the information. Usually it's a month.
So we're gonna let this homeowner be out there with bacteria in his water and have to go through winter with this then?
Well, we have a state law that says that a well is supposed to be 100 feet. Now, we
Right.
as a board can't legislate and change the law unless we follow the law that says we have to have enough information to feel comfortable that we should make this variance. And we have to make sure that the variance we grant is reasonable. And you've heard the board say we don't have enough information tonight, so, I mean, we'll try to get the information that we need, so that we can make a decision. And we'll do it as fast as we can. And then maybe like Supervisor McDonough suggested, you could talk with the DNR who has advised us not to approve choice number one. And then we'll go from there. Okay.
Anything we're relying on, we should be giving to the parties, right? So if you've got something from the DNR, we could make photocopies and.
Well, I would think that, you know, we'll discuss it with the DNR. I mean, I don't think it's appropriate really to share emails unless you checked with the person who sent the email. I mean, that would be my opinion. I think they need to have the information. The homeowner needs to have the information. But I wouldn't just hand out an email.
So kind of came to this meeting blind that option was not even gonna be feasible.
It's been, I guess we just heard today or yesterday, late yesterday. Pardon me?
3:18 p.m.
Today we heard. So I'm sorry that we didn't hear sooner. So it's been moved and seconded to table the variance request. Is there any further discussion?
What's the possibility of calling a special meeting if we do hear from the DNR and from Bailey and from Adam? Possibilities before the December meeting.
I'm always happy to do that.
I mean, that's another thing. We don't have to necessarily wait a whole month. We could, if everybody gets it together and gets it figured out, we could have a special meeting and get it figured out and voted on in pretty short order.
Sure. If we can get the information, we'll act on it. Absolutely. Okay, I'm sorry. Next is review. Oh, no, let's go back to the regular order now.
Did we vote on the table?
Oh, did we? I don't think I did. We're ready to vote on the table. All those in favor say aye. Aye.
Aye.
Those
Aye.
opposed? Hearing no opposition, it passes. Okay, so let's go back to the regular order of the agenda, and we're at the approval of the minutes. Is there a motion to approve the October 18th, 2023 minutes and the opioid subcommittee meeting minutes for November 2nd, 2023?
I move we approve both minutes for both meetings.
Is there a second?
Second.
It's been moved and second. Any discussion concerning the minutes? Hearing none, all those in favor of approving the two sets of minutes say aye. Aye. Those opposed? No opposition, the minutes are approved. Next, we have presentation and reports, and we're happy to have the VNA monthly report given by Stacy Killian tonight. Thank you.
Good evening, everybody. So just some updates. My written report is in the packet as well. We have been working on trying to fill for a very long time now some of our home care aid, homemaking open positions. We have a couple new applicants this week, so interviews going on. So fingers crossed. Nurse positions, and so they're nursing students that are looking for something part-time. So we're hoping to be going down that avenue. I know we opened up our hours. Traditionally, we've been running our homemaking home care aid during the time that our office is open, which is 8 to 4:30 Monday through Friday, with a little variance in the morning and in the evenings. And now we're offering evenings, weekends, if it's gonna mean we can get more staff in there. That's kind of our hope. But we did add 2 new patients in this past month, and we did increase our homemaking home care aid visits, 28% for home care aid and 17% for homemaking. So we're happy about that. Hopefully by next month, I have something exciting to report on interviews, fingers crossed. In general, we have actually quite a few new hires, open positions. The most we've probably had in quite some time. We've had a lot of retirement lately. We have obviously our home care aid positions open, our Ryan White coordinator for our Ryan White program, that is recent, and we just filled that with an internal staff, Danielle Simpson. We have
Who was that?
Danielle Simpson. She's worked in our Ryan White program for a while as a case manager and has just stepped up to do coordination. We are filling her positions. We have a full-time case manager position, posted and a part-time case manager position, and they're both in Ryan White. We just hired a PRN dental assistant, Celeste Strong, and one of our dental hygienists here that works with our early childhood program is retiring in January, and we just submitted an offer for her position. So we're excited to get somebody in place before she actually retires and walks away with all that knowledge. Exciting news, we have a small little satellite clinic opening up. We're running out of space in our new facility. We need some more clinic space, and so we worked with Finley, and we are going to move Ryan White and Family Planning into a separate clinic near the hospital. It's on University in Delhi Point. It's just a small area to move those two programs just to give us more clinic space. And so we'll be moving in there in about 2 weeks or so, but we're excited. It's on the bus line. It's close to the hospital, which is good for labs and things like that. And I think both those programs, 1400 University.
I just thought it'd be good for the minutes to have an address.
Yep, and you'll see our sign is actually up and running now, so, we're excited over that. I think it's gonna give us an opportunity just to increase some clinical services, because we really don't, with WIC, we don't have the space right now. And we're trying to increase WIC too, which is, we're running out of space, but this is a good, solution for a while. Also, just something that came up this week, we had, gotten an email from the state. We are a bridge access provider, which is how we give the COVID vaccine to the uninsured and underinsured. It looks like they're going to pilot a program for adult influenza vaccines beginning next year for any of the bridge access providers. And so we got a survey about whether or not we'd be willing to participate, which we will absolutely, to be able to offer influenza vaccines to uninsured and underinsured adults. So we don't have a whole lot of information. It was just a survey on our willingness to participate. I think it's a good benefit for Dubuque County. So me and I will definitely step up to participate there.
So could I just interrupt one more time? For that bridge program, is that something that you could take into the county, like with maybe the mobile mercy unit to provide shots to Cascade or Epworth or Dyersville?
So the bridge program is only open to public health. I don't know if, I think it's just local public health offices and FQHCs, which is
Okay.
Crescent and the new.
So you can't take it off-site?
We can, we just have to be the one to provide the vaccines.
I just
don't
meant
know.
if Mercy drove the bus, you staffed the bus.
Possibly, yeah. I mean, there's definite possibility there to go out in the community. We're pretty used to being portable, so it's something we could definitely look into. We've still seen pretty low COVID numbers, but again, who we can vaccinate is a very small group, which is unfortunate. We still get the calls. We're trying to connect them wherever we can, based on that, and we're still getting quite a few children, which is good to see, so. Other than that, we are continuing, like I said, with our COVID clinics every Friday. They're going well. Our grants, most of them restarted in October 1st, and that's been going pretty well. I think we're on target with our grant spending and things like that, where we feel like we should be. Our deficit funding's a little bit over where I like to see us, but that's not uncommon. It kind of ebbs and flows throughout the year, just depending on what's going on. And we had quite a few programs that ended in September, and that kind of impacted the budget as well. So, nothing that we aren't monitoring. Things are going okay.
I noticed that you did something with John Deere. What
We
was that?
actually attended one of their health fairs and brought all of our programming out there to them for the employees. And it's something that I think they've done, I don't know for how many years, but we've been able to connect with the employees there, offer services, make sure that they know what we do and what we could benefit to both them and the community.
Is there a way to partnership with that big business? I mean,
We actually have in the past. They've actually been very, very hands-on with immunizations and real big supporters of our vaccination programs. And so in the past, we have partnered with them to expand the vaccines that we do give and things like that. So yeah, absolutely.
great. Thank you for your report, Stacy. Next, we have the Dubuque County Public Health Department report given by our director, Ally White.
First, thank you for all you're doing. It's a lot of work, and a lot of it on our behalf, so thank you. probably the most important thing that I'm excited to report on today is that we did complete our community health assessment and improvement plan. That is a large initiative and something that we choose to do jointly. I've spoken a little bit about it before, but for those who aren't aware, a community health assessment and then the corresponding improvement plan is a requirement of local public health departments to complete every 5 years. We chose to partner with some other healthcare agencies in our area who have similar requirements, rather than create different plans at different times, to come together, form partnerships, collaborate, and the outcome is one cohesive community health assessment plan. What this plan does is basically forms a blueprint for the work that we will do in public health over the next 3 years. And I say 3 because we do anticipate that we will continue to partner with the local organizations.
And they're every 3.
And their schedule is every 3. Yes. So the work that we have done in the past year will help drive the work that we'll do over the next 3 years. It began with a community survey. So the most important thing for us was to hear from the community what they need, what they want, what they feel that our strengths are. The way that we did that was by creating an online survey, and it was linked to a QR code. We traveled around the county to some of the more frequently visited rural locations and placed flyers that contained that QR code. So your phone would take you directly to the survey and you would complete it that way. We also had paper copies available at various locations for residents to complete that way, should they choose. And we had a pretty good response rate. I think we had close to 800 people who completed the survey and I believe all of our zip codes were represented in that response.
Do you have any statistics on how many completed with the QR code and how many did it paper?
That may be part of the appendix on the report. If it's not, I think that's information that we could get.
I just think it'd be good for the next time, so you know where the target should be.
Yeah, I agree. Thank you for that suggestion. So then we compile the survey information, and then we also use different data sources that are available to us, both locally and at the state and national level, so we can kind of compare where we're at. A review of that data plus the surveys that we looked at led us to our top 3 priority areas that we would like to focus our work on. One is brain health and substance misuse. One is physical activity and nutrition. And one is access to dental care. So after we identified those 3 priority groups, I took a group to lead, Stacy took a group to lead, and Amanda Jansen, so she is a representative from Mercy One, Dubuque and Dyersville. She took a group to lead as well. So we held focus groups with stakeholders and came up with some strategies on how we could best work to improve the services that we're able to offer in those areas. Yeah,
One of the things, Ellie, when we started, when we went off track with the hospitals, which is what we've typically done in the past, they had, during COVID, while we were focusing on that, they did their survey. And so all of their data and their survey results and their ultimate plans were shared with us at the very beginning. And they chose to still remain partners with us throughout this. And I think that was important because that was a lot of data and a lot of information that went out to the community as well on their end prior to us, starting this process, but it was shared in part of this. So I think that's just important to note.
Thank you. Yeah, I mean, this is our first go around. A lot of us on the steering committee, were new to this process and we did not have a lot of time. It's a process that typically can take anywhere from, I mean, it truly is an ongoing thing. If to do it right, you're working continuously in every 3-year cycle. So I think we had a short turnaround time. I'm pleased with the results. I do think that they reflect what our community told us that they needed, and we came out with some ways that we can actually make some things happen to address those areas. So there were things that we learned, and there are things that, you know, we'll make note of and implement to do differently next time to keep improving that process. But all in all, it's a document that I'm proud to put her name on. And then that document is part of the packet, so I'm sure you all had a chance to at least glance through it. I know it's very lengthy, but should you review it later and have questions, I always welcome them. In other news, grants to county, we tested 62 private wells this quarter, 1 well closure, and I think there was one that was reconstructed, and then of those private wells that were tested, 9 must have been positive for bacteria, so the grant also covered for those 9 wells to be shocked with chlorination. And so the total expense for the quarter was $14,620, which is 29% of our annual grant amount.
Is that what it usually is at this time?
That's an excellent question, and I don't know the answer to that.
Back a few years and we didn't even.
Yeah, true.
Yeah, I think it really speaks to
Cause I
the
know
work
that
that's being done.
there's a lot now and then winter slows down. And then I think it heats back up again in spring with the warmer weather. So I just wondered if 29 was, maybe if you could ask Bailey just to.
Yeah, absolutely.
Let
And
us
this is
know.
kind of the first look that I've really taken into it. I'm learning as I go too, so, just to kind of try and get a pulse on it. But I do think, well, I know there's a lot of good work being done. I mean, those are 9 wells that,
Yeah, 29%'s a high, I think, high percentage to have done.
well, that means 29% of we've spent 29%
Yeah,
of our
I think
annual
that's a
budget.
lot.
Yeah.
Cause when did it start? July 1st?
Mhm.
I think that's great.
Mhm.
It's very consistent with where we're at with our grant spending too.
Is it? So lots of good work being done there, and it really does benefit our community, so. And then also we pulled the providers and then compiled that document that Chairperson Larson had shown earlier about where our residents can receive seasonal vaccines. There were some changes, as we're all aware, this year to. What's that?
Sorry, there was a bucket.
Oh,
To back- I'm like, I heard it. I don't know where it went, but
that's right.
I just heard it buzzing.
So yes, we were able to get that information. It is on our Facebook page and it's also on the Dubuque County Health Department website. And we're not done yet. I do want to work with some advertising and that sort of thing when time allows. Policies and procedures is one thing that in the past year I've been wanting to establish for our department. As we are so fortunate to welcome new staff, it's an ideal time for me to identify which procedures are priorities. And the first one that I identified was a procedure for payroll processing, how we track our hours when they're turned into me, how I get them to the Human Resource Department. So that is an internal document, but it will help guide the work that we're doing. When you look at the current and ongoing projects, we are still working hard at our strategic planning. So I've been in communication with the consultants. They will be here December 1st. They have a great full day planned for us. And the morning session will be about evaluation, and then they call the afternoon session Aspire and Resolve. And so we'll walk away from that meeting with some documentation. Up to this point, they've really been surveying and researching what we have available and that sort of thing. The one question that they have been asking me is if we have an update on the realignment with the state of Iowa. I was expecting, late October, early November to have some information. And to date, I've not received anything. I did contact our local consultant yesterday, who is in the same boat, but did have some meetings coming up and she thought that maybe she would have more information to share at that point. So I do think that the consultants are looking for that information so that they can help best advise us on how to proceed within the, whatever that new framework is going to look like. Now, that being said, we will meet December 1st, one way or the other. But hopefully we'll have some more information from the state at that point in time. There is a local public health system survey that needs to be completed by the end of the month, and that's a grant requirement. Stacy's offered to assist me with it because that is this will be the first time I've worked through that. And I think that looks a lot at staffing and structure of our department. Last month I had shared that I had attended a department head leadership workshop. Last week we had our second of 3. Again, it was beneficial. And if nothing more, a great opportunity for leaders to collaborate. There aren't a lot of opportunities to just have open discussions, so I thought that was very helpful. Our digitization scanning project is moving forward slowly but surely. We went out and had to seek additional bids, and the original company did come back as the most economical choice for us. So we will meet actually tomorrow to discuss next steps, which will likely be packing our records into boxes and shipping them out to be scanned. And then just to put on your radar, fiscal year 25 budget presentations, we've been told we can select one of 3 days to present, I believe, the 7th, 8th, or 28th of December. So we'll be looking to complete that budget, at least a framework, and then I can develop the presentation around it. But we do need to begin moving on that.
That is operational budget. That is not budget improvements.
Okay.
So there's 2, so this is operational.
Not
Then if you are going to be making or asking for changes or significant capital investments or improvements, then that would still be in the new year.
Which would be when? We're not
Not
sure
sure
yet.
they're determined, but we're trying to
Okay.
get the operational budgets known.
Okay, that makes sense. So the cost that it takes to pay our employees and operate the day-to-day.
And
Okay.
Stella should be walking you through all that. And I
Yes,
know,
she's
I think Sandra wanted to
fantastic.
be involved in that as well, just to,
Yes.
know,
Yep, they have a
typically
committee.
that's been the case.
Thank you.
Yeah, I would think that you could use your finance committee for both. The operational and the.
For sure. You'll notice a new face in the room with us today. I'm very excited to welcome Carissa Brown to our team.
Welcome.
I don't know where the camera is, but hello.
It's Carissa's 3rd day with us, and she's kind of hit the ground running, so we're excited to welcome her. She has a unique degree, which I think will really benefit the county as a whole. She has a master's in management, organizational diversity, and inclusion leadership. Did I get that
What
right?
does that mean?
Basically, a lot of people who pursue that degree can be like chief diversity officers or something or go with that, but it's kind of how to implement diversity programs, initiatives, different things into any organization you go to. So it was half business classes I took and then half classes focusing on diversity, how it appears in different organizations, and how you can go about implementing it in different ways, like employee resource groups or something.
Does it include equity and inclusion or?
Yes.
I know all the buzzwords.
Good question.
So I think it it really interfaces with public health. I mean, equity and inclusion are huge focuses in the public health world. And so I really look forward to that unique perspective that Carissa will bring to our team. And you have an undergraduate degree as well, which is in
Criminal justice. So, yeah, they kind of go hand in hand, and it led me to my master's degree. Thank you.
welcome. And Noah is nearing his 30 days with us,
Wow,
right?
that went
In
fast.
2 days.
Seniority, so.
So, we're working hard to provide, an onboarding process that will allow these two stellar people to continue to grow with our department. So, welcome aboard.
Thank you,
It-
Ally.
Sure, just real quickly, there's two other quick things.
Okay.
Sorry, I'm long-winded today. We did have one more resignation from the Food Policy Council, so there will be discussions on, the future of that. And then
Is he the grocery store owner in Upper?
nope, that's a different one.
Who's Rich? Is he for Presbyterian Church? I believe so. Okay, yes.
Yep.
Just trying to remember the name and the face of the job.
Yes.
Okay,
Yeah.
well, that's a big loss. That's too bad.
I only had been, attended a few short meetings, in my time with the Food Policy Council, but he brought a lot to it. And then just real quickly, the after action report. I did hear back, we had asked the consultant to reach out to the former director of health with Dubuque County. And she did review and then had asked that just a statement be included that her, input was inadvertently omitted. So we'll be looking for a disclaimer, to be added to that report.
Thank you, Ellen. And welcome, Carissa Brown. We're very happy to have you here, and we're excited about the work you're going to do alongside Noah. So, welcome to both of you.
Thank you.
Very good. Next, we have an action item, review and approve the community health assessment and improvement plan. Yay, you got it finished before the deadline. Yay! We need a party. I wish I had some confetti.
The scene us at 4:35 yesterday trying to upload the PDFs and
And when does this have to be to the state?
17th.
The 17th, which is
Friday.
Friday. And how do you get it there?
Email.
Email, okay. Great. That's wonderful. I read this and, it was really great reading. I appreciate all the hard work. I would just suggest these colors are really hard to tell.
I
Okay.
couldn't tell.
I
which
couldn't
was
tell
which.
what's the
Okay.
difference.
Or use a different graph.
Something, yeah, that's all. I mean, those greens looked pretty much alike
Right.
from my eyes.
I agree.
And then, I had one question about the plan for, physical activity, nutrition, and obesity are priority number 3. What is, I'm not sure I understand the third objective, continued obesity-related goals in Dubuque County that pertain to physical activity and nutrition. Want to look at it?
Yes, please.
Because maybe words miss it. I just wanted to be able to understand.
No, and it could very well be a typo that we need to. Yeah, I think it was about reducing barriers, but I can see where that could be reworded.
Okay,
Yes, I appreciate that.
thank you, Ellen.
I didn't see it on here. Did you ever get the stakeholders that were in the brain health substance use disorder? So it was a very vibrant group
It
and
was.
very well-rounded group.
It was.
It was included? Okay.
No, I am agreeing with you
Oh,
that it
okay.
was.
It wasn't
And I
exclusive.
recall, it's been a whirlwind. I did reach out to the person who led that group, but I don't recall. I don't recall why that was not included, but I will follow up.
So it should be, it was a lot of, yeah, really good organization, just for anything, and just to have that list in case you need to,
Yeah, it was. I was mentioning that. I thought I went to one of
Yeah,
those
you went to
meetings
the
and
one,
there were
yeah.
like 30 people there around the table. I mean, it was wonderful, a wonderful group. Now, I just have one question about diversity. There's one section in here, and I think it's probably something that just comes from some form, but it was about housing. And it refers to blacks several times. And I'm just wondering, is that appropriate? Is that
I
an
wondered that.
appropriate way to address
I
that?
wondered that myself.
Yeah,
From what I've learned, it really depends on the individual. Like some people are fine with being referred to that, some people aren't.
Sometimes it's black / African American.
Yeah.
yeah. I
And
wonder if
black's always capitalized.
because sometimes it's, yeah, and it wasn't capitalized. So I would just go to the housing, maybe I can find it, but the housing part here. And maybe capitalize black and maybe / African American or something like that. It felt odd reading it
Okay.
that way, so.
Okay. And I noticed it says whites also,
Yeah.
so I would capitalize that as well.
White doesn't necessarily get capitalized. Correct, Maya?
Put me on the spot here. Yeah, AP style changed it to black is capitalized, white is not. Some people do. That's just kind of like style differences. I'll check on that actually. Let me double check on that before you change anything, but I do know for sure black is definitely capitalized.
I think it's optional.
I think, yeah.
I mean, you could just have it consistent.
Thank you for that. So very good. I'm so happy that this was, I know this took a great community effort and a joint effort, so I know it was a lot of work and I appreciate it getting done under the deadline.
Well, and I'd just like to say thank you to the city partnership too, and hospital partnership. This couldn't have been done without the collaboration. And, that was just great that the county was able to do that and put it together in this very nice format.
Now, I'm not sure if do we have to vote on the approval of this, do you think?
I think so.
Is there a motion to approve the community health assessment and improvement plan?
I'll move that we approve it with the necessary edits made and completed.
Is there a second?
Second it.
It's been moved in second that we approve the community health assessment and health improvement plan. Is there further discussion? Hearing none, we'll take a vote. All those in favor of approving the plan, say aye.
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 Those opposed? Hearing no opposition, it's approved. Yay. Something off the table, Ally.
Yes, that feels good. Thank you.
All right, very good. Thank you. Let's see, next we have a response to public questions. I haven't really gotten any public questions this month. Has anyone else?
No, the only public question I had was the immunizations, and I think that's gone out onto the Facebook and
Yeah.
and the website. Is it on the website too?
Okay, then unfinished business. I'll just make the announcement. The Finance Committee meeting is pending. The Performance Review Committee meeting is pending. And let's see, the opioid subcommittee status. I'm not sure, Ally, what your thoughts are on that, whether we need to continue that or whether you guys now will go ahead and get the community committee going or.
If I recall, at the last opioid subcommittee meeting, it was determined that the group would like to meet monthly for 3 additional months. And I think last time we met was one of 3, right?
Yeah,
So
2 more times.
we would like 2 more meetings. I think that's a good plan. I think we should stick with that. That will give time to bring Carissa kind of up to speed on discussions that we've had in the past, and then allow you to kind of be able to take the lead on that.
Okay, so we'll then be getting some notice about possible December meeting and possible January meeting.
Yes.
Okay, great. Next we have new business, and that's the review of the 2024 meeting schedule draft, which was attached. And it looks like, I mean, I think It's the third Wednesday of every month. And we're not required to meet monthly, so this might be a good time to just bring that up, whether the board thinks we should stop meeting monthly and we can go, I think we have to meet 6 times a year.
Could I just, one comment, when I made the agenda, I think I highlighted the one, Juneteenth is now a holiday.
Okay.
And I think June's meeting falls on that day, so the county offices would be closed, so I left it as is, but wanted to bring that to
We'd
your
have to
attention.
change that date. Okay, so does anyone have any opinion on whether we should continue to meet monthly or any thoughts on that? Amy, do you have any thoughts?
Yes, I do.
You're the one.
I have
you're
a
the one in
master
the room.
plan. My proposal would be that we would have every other month meetings, and then in that off month, we would have work sessions, which would be, we would bring in speakers and learn more about health-related, public health-related topics. So the public would still be invited. It just wouldn't be a formal meeting. I don't know if anybody else likes that idea, but, and we have committee meetings at that time as well. Instead of trying to pack those things into the meeting, you know, on top of the agenda, we would have a separate, without having to meet twice a month.
I would ask Ally what it is that she might need in terms of frequency of meetings with the board.
Thank you, Mike. The first year I have found the monthly meetings to be very beneficial. That being said, I like the idea, that Amy's proposed. I think that gives an opportunity to still, connect and have informal conversations and questions and answers and that sort of thing. When I think of like the actual Board of Health meetings and the variances and that sort of thing, I feel like that could potentially switch to every 2 months.
I just think with the objectives with the CHA chip, that we could really make that a dynamic living document, that we would be pulling in speakers and presenters for those 3, especially 3 identified areas. And like, you know, VNA could come in and give a breastfeeding or teeth cleaning or something presentation to us and to the community. That would just, I think, be a very beneficial and dynamic way to try it. I'm all about trying things for the first time, and if it doesn't work, you scrap it, but,
You're gonna put your contractors in a difficult situation if you table, you're tabling for a very long time.
but we could always call a special meeting.
And the county has taken a more active role in, as you saw this evening, in making decisions about the DNR and about state law and what we're looking for. So that I would weigh that as you think about the press of business. And it would help maybe new staff members to, don't disagree, but I think there's some things you might want to know about how the county runs with your meetings are helpful. That are not breastfeeding necessarily.
Why don't we put this on the agenda for next month to kind of discuss what we want to do next year as far as meeting wise, and another thing that will need to be on the agenda next month is selecting a nominating committee for officers next year. So, okay. Is everybody okay with doing it that way? Okay. Very good, thank you. Next, our next meeting, this is the time now that the rest of the board can speak up and give reports and talk about whatever you'd like to talk about, bring up whatever you'd like to bring up. And it's your time, so. Anybody on Zoom wanna say something tonight? Nope.
I'll go ahead and just share that probably since the beginning of the month, we've had over 40 volunteers from working on behalf of Hillcrest at Murphy Park for the Reflections in the Park. So I think many people, if not all, are familiar with that tradition that starts just a couple days before Thanksgiving with a walkthrough, a walk through the park opportunity the first night, and then it's all by car from that point until January 1st. It's Hillcrest's primary annual fundraiser. All proceeds, once they offset the cost of certain things that we have to pay for in order to make that event work, go to delivering care and services for mental health, brain health, behavioral health in the community. So just wanted to remind people that we also are having a gala that the Diamond Joe is sponsoring for all of our business sponsors, as well as the volunteers that help set the park up. That's happening next Tuesday. It's just the way we say thank you for the time and talent and treasure that people put into making that event successful. So that's my announcement. Thank you.
Thank you, Mike. I look forward to that, reflections in the park. Okay, anyone else have something they'd like to add tonight? Board members?
I think that we should add that it was not in your report, that the subcommittee for the opioid was trained in the Narcan, how to administer Narcan.
We were.
And so we will be getting 5 Narcan kits as a result of that. 5 or 10? Maybe 10. There was a lot of people.
Yeah, that was very good training, and I could just see that going all over the county, really.
She did a nice job.
Yeah. Okay, very good. Anything else, Amy?
No, I've talked enough.
Thank you, though. We appreciate your input. The next meeting will be December 20th, 2023 at 4:30. Everybody will have their Christmas shopping done, holiday shopping done by then, I'm sure. At this time, we'll have public comment, and anyone may address the board on matters which are of concern to that person, which are not agenda items. Please raise your hand if you're on Zoom or if you're in the room, and if you're called upon, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and the Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Are there any public comments tonight? Hearing none, is there a motion to adjourn? I move we adjourn. How about that?
As the chair, you can do that.
We're adjourned. Thank you. All right.